Hello there, welcome to Dr. Sushant's anatomy tutorial. In this video, I am going to talk about the knee joint. The knee joint is the largest and the most complex but not complicated joint in the body. So I will try my level best to make it as simple as possible. So the competency I am going to address in this class are describe and demonstrate the type, articular surfaces, capsule and synovial membrane, the ligaments, relations, movements and muscles involved, blood supply, nerve supply, bursae around the knee joint. Explain the anatomical basis of locking and unlocking of the knee joint. Describe the knee joint injuries with its applied anatomy. Explain the anatomical basis of osteoarthritis. So the specific learning objectives of this class would be giving an introduction to the knee joint. Then I will go on to discuss the classification, articular surfaces, ligaments, relations, blood supply, nerve supply, movements, muscles producing the movements, and applied anatomy of the knee joint. So let us begin by reading this case scenario. A 16-year-old male football player presents with right medial knee pain of 2 days duration after having been tackled during practice from the left side and at the level of his lower thighs and knees. He reported that the force of the tackle was directed at his lower legs and that his feet were planted on the ground at the time of the tackle. He reported that following the tackle, he was unable to get off the field due to knee pain. There was pain, especially on medial rotation of the tibia on femur. He also had difficulty straightening his knee. Now, the question here is, what is the probable diagnosis? So at the end of the class, you will be able to answer the question. Now, let me give you an introduction to the knee joint and then I'll tell you the classification of the knee joint. Basically, the knee joint is a largest joint. All right, it is formed by the fusion of three primitive joints. So three primitive joints join to form the knee joint. What are these primitive joints? So there is medial femorotibial, okay, medial femorotibial joint. There is lateral femorotibial joint and there is femoropatellar joint. Okay, and this is a compound joint. What is a compound joint? Compound joint is when more than two bones are articulating, right? So here basically this joint incorporates two condylar joints. There are two condylar joints between the femoral and the tibial condyles, and there is a saddle joint between the femur and the patella. Now, unlike the typical hinge joint, right, where there is only one transverse axis and the movements taking place are only flexion and extension, knee joint is a modified hinge joint, all right, because the axis is not fixed. Okay, the axis is not fixed. So the knee joint is also a complex joint. What is a complex joint? Complex joint is a joint which is divided partially or completely into compartments by what is called articular discs. So here we have something called the menisci, the medial and the lateral menisci. So these menisci are going to divide the cavity of the knee joint into meniscofemoral and meniscotibial compartments. So these are incomplete compartments within the knee joint. Therefore, It is a complex joint. Now, when we look at the classification of the knee joint, it is a synovial joint, obviously, and it is bicondylar because we have the two condyles of the femur and the two condyles of the tibia articulating with each other to form the knee joint. And it's a modified hinge variety. Because I already told you, unlike a typical hinge joint, the transverse axis of the flexion and extension is not fixed in knee joint. So what happens during extension, the axis passes forwards and upwards, right, and are invariably associated with the conjunct medial and lateral rotations along a vertical axis. So you will get to see two axes in the knee joint. There's a transverse axis along which flexion and extension of the knee joint takes place. We also have a longitudinal vertical axis along which slight medial and lateral rotations take place. That is when the knee is being locked and unlocked. Therefore, it is a modified hinge variety. So what is a typical hinge joint? Typical hinge joint is a joint where only two movements are possible along one single axis. The movement, like in elbow joint, the movements possible are flexion and extension. But in knee joint, we have, in addition to flexion and extension, slight medial and lateral rotation. Therefore, it is a modified hinge variety of synovial joint. Now, what are the functions of the knee joint? One of the important functions is weight bearing. It bears the weight of the body. And it is essential for daily activities like standing, walking, climbing the stairs. All these activities require a normally functioning knee joint. Mainly during sports like running, jumping, kicking, etc., the knee joint is actually very, very important. Now looking at the articular surfaces. The articular surfaces are formed by the condyles of the femur, as you can see here, the medial and the lateral femoral condyles, and the condyles of the tibia. This is the medial and the lateral condyle of the tibia, and we also have the patella. And remember, the articular surfaces are covered by the articular cartilages. So these articular cartilages are shown here. Something that appears in white color or maybe gray color is the articular cartilage. Now, there are 13 ligaments in the knee joint. What are they? The capsular ligament, the ligamentum patellae, tibial collateral ligament, fibular collateral ligament, anterior cruciate ligament, posterior cruciate ligament, oblique popliteal ligament, arcuate popliteal ligament, medial meniscus, lateral meniscus, coronary ligament, transverse ligament, meniscofemoral ligament. In the upcoming slides, I will discuss each and every ligament of the knee joint in detail with its clinical application. So in this picture, we can see most of the ligaments, if not all the ligaments. So let's try to identify the ones that are seen. So we see some of the ligaments of the knee joint, such as so this one right here is the ligamentum patellae. Ligamentum patellae is seen, and then we have the anterior cruciate ligament, this one right here, and then we have the posterior cruciate ligament. We have the fibular collateral ligament on the lateral side. We have the tibial collateral ligament on the medial sides, the tibial collateral ligament, the fibular collateral ligament. Then we have the meniscus, the lateral meniscus, the medial meniscus, and then we have here, what we have here again, the oblique popliteal ligament. Then we have the posterior cruciate, the lateral meniscus, the posterior meniscofemoral ligament, the popliteofibular ligament. All the different kinds of ligaments are seen in this picture. But don't worry, I will show you each and every picture of each and every ligament of the knee joint in the upcoming slides. Now, so first let us begin our discussion with the capsular ligament. So we will talk about the capsular ligament first. So the capsular ligament, it envelops the joint, right? It is like an outer packing of the joint. So it basically envelopes the joint. But remember, the capsular ligament is deficient right above for the suprapatellar bursa. So for the suprapatellar bursa, the capsular ligament is deficient, right? And the capsule is strengthened, and also, and one more place the capsule is deficient, that is behind the lateral condyle. So behind the lateral condyle the capsule is deficient, and that is for the tendon of popliteus. So we know the popliteus muscle takes intracapsular origin from a depression on the lateral surface of the lateral condyle of the femur, like the long head of the biceps brachia, which takes intracapsular origin from within the shoulder joint. So we have a deficiency in the capsule of the knee joint for the tendon of the popliteus to come out, right? And the capsular ligament is strengthened on the medial side by something called the tibial collateral ligament, which is abbreviated as TCL. Posteriorly, it is strengthened by the oblique popliteal ligament. Anteromedially by the medial patellar retinaculum. Anterolaterally by the lateral patellar retinaculum. And we also have the iliotibial tract. The upper and the lower attachments of the synovial membrane lines the inner surface of the fibrous capsule. So we know the fibrous capsule on the inner side, the fibrous capsule is nothing but the capsular ligament. On the inner surface, it is covered by the synovial membrane, and the fibrous capsule is strengthened by these ligaments, namely the oblique popliteal ligament, tibial collateral ligament, medial patellar retinaculum, lateral patellar retinaculum, and the iliotibial tract. Now, what is the superior attachment of the fibrous capsule? Anteriorly, above the patellar articular surface of the femur, the capsule is deficient for the communication with the suprapatellar bursa. Suprapatellar bursa comes out of the knee joint cavity through a gap that is present anteriorly above the patellar articular surface. As you can see here in this part, the capsule is deficient for this suprapatellar bursa. Alright, now the capsule posteriorly is attached to the upper margin of the intercondylar notch. So this is the intercondylar notch. So posterior attachment, this structure in green color is the capsule of the knee joint. So we are looking at the posterior attachment of the capsule of the knee joint. So posteriorly, in the middle, it is attached to the upper border of the intercondylar fossa or notch, and it is close to the articular margins of the medial and the lateral femoral condyles. This is the lateral condyle, this is the medial condyle. So this attachment is close to the articular surface of the medial and the lateral condyles of the femur. So medially, the attachment is represented by a continuous line along the medial surface of the medial condyle. This is the medial condyle, the lateral condyle. So medially, the capsule is attached to along the medial surface of the medial condyle about 1 centimeter above and parallel to the articular margin. So which is the articular margin, so about 1 centimeter above and parallel to it, 1 centimeter above and parallel to it, the medial attachment of the fibrous capsule can be seen. And on the lateral side, the attachment is along a continuous line that is along the lateral surface of the lateral condyle about 1 centimeter above and parallel to the articular surface of the lateral condyle And also the articular margin, the line of attachment of fibrous capsule in the lateral margin includes the tendon of popliteus, but it excludes the lateral head of the gastrocnemius. So the meaning of this sentence is that the origin of the tendon of popliteus is intracapsular, the popliteus muscle, whereas the attachment of the lateral head of gastrocnemius is extracapsular. So what is extracapsular? Lateral head of gastrocnemius is extracapsular. So the attachment of the fibrous capsule, first upper margin of the intercondylar area, then the articular surface of the medial and the lateral condyles of the femur close to the articular margin, along the medial side and the lateral side 1 centimeter above the articular margin. So that on the lateral side it includes the tendon of the popliteus within the capsule and the lateral head of the gastrocnemius outside the capsule. Now, what about the inferior attachment of the fibrous capsule? So inferiorly, the fibrous capsule is attached to the tibia. All right, so this is the tibia here, and then we have the fibula here. So the fibula is not taking part in the formation of the knee joint. Please remember that. So the inferior, let us look at the inferior attachment of the fibrous capsule. So it is attached to the tibia. So where? In front, that is anteriorly, the fibrous capsule is attached to the sides of the triangular surface of the tibia, blending with the medial and the lateral patellar retinacula, and below to the tibial tuberosity. The tibial tuberosity here, so the attachment extends along this line, a triangular area on the anterior aspect. Posteriorly, this is posterior, this is anterior. So posteriorly, the fibrous capsule is attached to the posterior margin of the intercondylar area. This area is the intercondylar eminence, and this is the intercondylar area. So posteriorly, the fibrous capsule is attached to the posterior margin of the intercondylar area and adjoining articular margins of both medial and lateral tibial condyles. So the articular margin of the medial condyle, articular margin of the lateral condyle. So along the periphery of the articular margins, we have the attachment of the fibrous capsule posteriorly. Now, behind the lateral condyle, the capsule is deficient for the tendon of popliteus. So superior attachment is once deficient, but anteriorly for the suprapatellar bursa. Inferiorly, the fibrous capsule is deficient over the tibia for the tendon of popliteus. So these two things are worth remembering. So behind the lateral condyle, the capsule is deficient for the tendon of popliteus, and on either side, the capsule is attached to the corresponding margins of the articular surfaces of the tibial condyles through the periphery, basically. So that's the inferior attachment of the fibrous capsule. So inferiorly, it is attached to the tibia, simply put, along the periphery of the articular surfaces, and is deficient for the tendon of popliteus muscle. Now let us look at the second ligament, known as the ligamentum patellae. Alright, so what is ligamentum patellae? The ligamentum patellae is derived from the tendons of the quadriceps tendon, that is quadriceps femoris. Right, it converges and forms the ligamentum patellae. Right, so this ligamentum patellae is superiorly attached to the apex of the patella. So here is the patella bone. So the ligamentum patellae, this is the patella ligament or the ligamentum patellae. So above, it is attached to the apex of the patella, and inferiorly it is attached to the tibial tuberosity. This prominence here is the tibial tuberosity. Subcutaneous and deep infrapatellar bursae are present close to its lower end. So in relation to the ligamentum patellae, we have bursae. We will talk about the bursae in a bit. All right, so this is the ligamentum patellae. So in this picture, we can clearly see the ligamentum patellae. So ligamentum patellae is the insertion of the quadriceps femoris, and it extends from the apex of the patella to the tibial tuberosity. Now coming to the third ligament known as the tibial collateral ligament or the medial collateral ligament. Alright, tibial collateral ligament or the medial collateral ligament. So in this picture, the medial collateral ligament or the tibial collateral ligament, abbreviated TCL, can be seen. This one is the medial collateral ligament. So this ligament morphologically is the detached distal part of the ischial head of the adductor magnus muscle. So it is a divorced tendon of the ischial part of the adductor magnus, ischial part of adductor magnus muscle. Now it has got two parts. It has got a superficial part and it has got a deep part. All right, so the superficial part attached above, it is attached to the medial epicondyle of the femur. All right, so above it is attached to here, this point is the medial epicondyle of medial epicondyle of the femur. Below, the superficial part is about 10 centimeters long and 1.25 centimeters broad. All right, so above the superficial part is attached to the medial epicondyle. Below, the superficial part of the tibial collateral ligament is attached to the upper part of medial border of the shaft of the tibia, upper part of the medial border of the shaft of the tibia. All right, now coming to the deep part, the deep part is attached to posterior surface of the medial condyle of the tibia along the upper margin of the groove for the insertion of the semimembranosus muscle, and it also blends with the fibrous capsule and the medial meniscus. This is very important. The tibial collateral ligament has a firm attachment with that of the medial meniscus of the knee joint. So here we see the medial meniscus, which is nothing but a white fibrocartilaginous structure. It is the articular disc of the knee joint on the medial side. So the deep surface of the tibial collateral ligament or the medial collateral ligament is firmly attached to the medial meniscus. All right, so it is very important to note that the deep part of the tibial collateral ligament blends with the fibrous capsule and the medial meniscus. So superficially, the tibial collateral ligament blends with the fibrous capsule, and on the deep surface, the tibial collateral ligament blends with the medial meniscus. So when the tibial collateral ligament is torn, it is usually associated with the tearing of the medial meniscus, and the reason for this is that the tibial collateral ligament is attached to the medial meniscus, unlike the fibular collateral ligament, which is a lateral collateral ligament of the knee joint, is not attached to the popliteus muscle. So there's a basic difference between the attachments of the medial and the lateral collateral ligaments of the knee joint. Remember, the medial collateral ligament or the tibial collateral ligament is firmly attached to the medial meniscus, whereas the lateral collateral ligament is not attached to the popliteus tendon. So that's the medial collateral ligament. Now let us talk about the fibular or the lateral collateral ligament. So this structure here is the lateral collateral ligament. So the lateral collateral ligament is also known as the fibular collateral ligament, FCL, fibular collateral ligament. Here you can see the fibular collateral ligament. So the fibular collateral ligament actually extends as a fibrous cord from the lateral epicondyle of the femur to the head of the fibula close to its styloid process. So here we have the fibula bone, and this projection is called the styloid process. This is the lateral epicondyle of the femur. So the fibular collateral ligament extends from the lateral epicondyle of the femur to the styloid process of the fibula. All right, that is basically to the head of the fibula, close to the the styloid process of the head of the fibula. Now, this ligament, the fibular or the collateral ligament or the lateral collateral ligament, is morphologically derived from the primitive origin of the peroneus longus muscle. All right, so the tibial collateral ligament or the medial collateral ligament is a remnant of the ischial part of the adductor magnus, whereas the fibular collateral, the lateral collateral ligament, is a morphological remnant of the primitive origin of peroneus longus muscle. Now, here is an important point. The deep surface of the ligament is not adherent to the fibrous capsule. Now, in the gap between the fibrous capsule and the lateral collateral ligament, or the fibular collateral ligament, appears the tendon of popliteus muscle. Appears in the interval. All right. Now, unlike the medial collateral ligament, which is attached to the medial meniscus, the lateral collateral ligament is not attached to the lateral meniscus. This is an important point to note here. So this explains the associated tear of the medial meniscus with medial collateral ligament. Remember, when the medial collateral ligament is torn, it is usually associated with the tearing of the medial meniscus, but this is not the case. When the lateral collateral ligament of the knee joint is injured, it is usually not associated with the tearing of the lateral meniscus, because there is no attachment between the lateral fibular collateral ligament and the lateral meniscus of the knee joint. Next, let us talk about the oblique popliteal ligament. So what is oblique popliteal ligament? This one right here is the oblique popliteal ligament, can be seen here also. So the oblique popliteal ligament is actually an expansion from the insertion of the semimembranosus muscle, right? So the oblique popliteal ligament, it extends upwards and laterally from the posterior surface of the medial condyle of the tibia. So this is lateral, this is medial. So this structure represented here is the oblique popliteal ligament. So it extends upwards and laterally from the posterior surface of the medial condyle of the tibia to the lateral part of the intercondylar line, of the femur, and it blends with the posterior surface of the fibrous capsule. And we know that the oblique popliteal ligament forms the floor of the popliteal fossa, and it is pierced by the middle genicular nerves and vessels, which are branches of the popliteal artery, tibial nerve, and the common peroneal nerves. So this is the oblique popliteal ligament. Is an expansion of semimembranosus muscle, and this is its attachment and the structures that pierce it. Next ligament is the arcuate popliteal ligament. So the arcuate popliteal ligament is actually a Y-shaped fibrous band, right? It's a Y-shaped band, the arcuate popliteal ligament. So the stem is fixed to the styloid process of the head of the fibula. All right, so it has got a stem which is attached to the styloid process of the head of the fibula, and the two bands, the anterior and the posterior. The posterior band arches over the tendon of the popliteus and is attached to the lateral condyle of the tibia. All right, so this is the posterior band, and the posterior band is attached to the lateral condyle of the tibia, whereas the anterior band is often deficient. When it is present, it passes deep to the fibular collateral ligament. It is attached to the lateral condyle of the femur. All right, the oblique popliteal ligament, the anterior band of it is usually absent. When it is present, it will be attached, it will pass deep to the fibular collateral ligament, and is attached to the lateral condyle of the femur. So that's the arcuate popliteal ligament. This one right here is the arcuate popliteal ligament. Now the next ligament are the cruciate ligaments. There are two cruciate ligaments. They are intracapsular structures, but they are extrasynovial, meaning they are within the capsule of the knee joint, but they are not covered by the synovial sheath. So the cruciate ligaments, they act as direct connections between the femur and the tibia, right? So the tibia and the femur, they are connected to each other directly by these cruciate ligaments. They are named as anterior cruciate ligament and posterior cruciate ligament. Now, according to their tibial attachment, they are named. So the anterior cruciate ligament is more oblique than the, anterior cruciate ligament is more oblique than the posterior cruciate ligament. Now both cruciate ligaments prevent side to side displacement, meaning this way wobbling, side to side, one is going in this way. So this side to side swaying is prevented by the anterior and the posterior cruciate ligaments, and both ligaments are taut during extremes of flexion and extension of the knee joint. So the anterior cruciate ligament is taut during extension, and the posterior cruciate ligament is taut during flexion of the knee joint. What is the meaning of taut? They become tight, stretched. All right, now before I go to the attachments of the anterior and the posterior cruciate ligaments, it would be wise to revise the attachments on the intercondylar eminence of the tibia and the intercondylar fossa, or the notch of the femur. So in the intercondylar eminence of the tibia, we have the cruciate ligaments, the horns of the cruciate ligament, the menisci, anterior horn, posterior horns of the menisci. So the structures at the intercondylar area of the tibia from anterior to posterior are the anterior horn of the medial meniscus, anterior cruciate ligament, anterior horn of lateral meniscus, posterior horn of lateral meniscus, posterior horn of medial meniscus, then is the posterior cruciate ligament. So that's the order of structure from anterior to posterior. There is anterior to posterior. We have the medial. There is anterior horn of medial meniscus. Then comes the anterior cruciate ligament. Then comes the anterior horn of the lateral meniscus. Then comes the posterior horn of lateral meniscus. Then comes posterior horn of medial meniscus. Then comes the posterior cruciate ligament. All right, so that's the intercondylar eminence. So this intercondylar eminence fits into the intercondylar fossa of the femur. First, let us talk about the anterior cruciate ligament in detail. So the anterior cruciate ligament, as the name indicates, passes upwards, backwards, and laterally. So this is the anterior cruciate ligament. Look at the direction. This is lateral, this is upwards or superior, inferior or medial. This is inferior. and this is medial. All right, so the anterior cruciate ligament, when you look at the direction of it, it passes from anterior, that passes upwards, backwards and laterally, upwards, backwards and laterally. And below the anterior, it is anterior cruciate ligament is attached to the anterior part of the intercondylar area of the tibia, between the anterior horn of medial meniscus and anterior horn of lateral meniscus. Above the medial surface of the lateral condyle of the femur, posterior superior part of the lateral wall of the intercondylar area. So that's the attachment of anterior cruciate ligament above, which is attached to the medial surface of lateral condyle. Medial surface of the lateral. See, this is lateral condyle. So this is the medial surface. Right. The posterior superior part of the medial wall of the lateral condyle of the femur. All right, so that's the anterior cruciate ligament. Similarly, we have the posterior cruciate ligament.